All right. Well, welcome everyone. We're so happy for you to be here today for another presentation in our All About Alzheimer's monthly series, where again, our goal is to bring you useful information that you can take back with you to either your respite support group or social support group, or for those of you who may be caring for family members um, within your home. We hope this information is useful and meaningful for you as well. It's a pleasure to be here with you today again. For those of you I haven't met, my name is Joan Asseff, and I am a licensed clinical social worker here in the state of Texas. I have spent most of my career working in settings with older adults and folks with disabilities in a wide array of settings, including skilled nursing facilities, hospice care, home health, which we'll be talking about today, psychiatric care, and private clinical practice, just to name some of the settings that I have worked in. I now teach clinical social work at the Steve Hicks School of Social Work at the University of Texas at Austin. I have worked extensively with individuals and caregivers going through the extreme challenges of Alzheimer's disease and other dementias, and I want to recognize the selfless and painstaking work that that caregivers do and those who support caregivers do in various ways to address and to cope with this difficult disease process. So I'm honored and humbled to be here with you today, as always. As you heard, we are recording today's session so others can benefit from the presentation later. And we invite your participation at the end of the presentation with questions and discussion. So I really welcome you to engage after we wrap up with today's presentation. So a quick note about Alzheimer's Texas before we dive into our material for today. As I'm sure many of you know, Alzheimer's Texas is an independent local nonprofit that used to be known as the Alzheimer's Association Capital of Texas chapter. They have been a privately funded voluntary health organization since 1982, so quite a long time now, serving Central Texans with Alzheimer's disease and their caregivers. About 3 or 4 years ago, Alzheimer's Texas broke away to form their own nonprofit and decided to focus 100% of their funds and efforts here in Central Texas. However, Alzheimer's Texas maintains the same level of commitment, providing support, education, and advocacy for those affected by Alzheimer's disease in our community. Alzheimer's Texas continues to carry out its vital mission to eliminate Alzheimer's disease and related disorders through the advancement of research and to enhance care and support for individuals, their families, and caregivers. All right. So again, like any good academic, I bring learning objectives as always. So I want to briefly touch on these. Today, we want to define and understand the spectrum of services covered under home health care. And I'll talk about what do I mean by the home health care benefit in just a few moments. We want to learn strategies for identifying when and how caregivers and family members can advocate for home health care services for their loved ones based on changes in condition that are so commonly experienced in this disease process. We also want to understand key differences between home health care and attendant care services. And there's some important distinctions there, and we'll go over those today. And then, as always, we want to think about and share ways we can support ourselves and others who might benefit from utilizing home health care services. So those are our general objectives for our time together today. Now, this graphic or this figure may be familiar to some of you who have attended my previous presentations, but I really feel like it captures so much about the care transitions that folks living with Alzheimer's disease and their families face. What research tells us is that people living with Alzheimer's disease and other dementias are frequently transitioning through various healthcare settings and levels of healthcare. I'm showing this here again to help us conceptualize the many care transitions people living with dementia often experience along with their caregivers and families. So we can think about where does home health care service, where do the home health care services fit within this spectrum of care? I am also opening the presentation with this figure to normalize the notion that most caregivers and families supporting those living with dementia will likely navigate several care transitions over the course of their loved one's disease process. Not always, but very often this is the case. This reality makes it even more important for caregivers and families to have practical knowledge and guidance in terms of which levels of care and services, such as home health care, are available to them as their loved one experiences changes in condition. For those who wish to stay in their home for as long as possible, which includes many people, and as safely as possible, home health care can be a helpful tool in terms of reaching that goal. So before I describe the services available through home health care, through the home health care benefit, I want to be clear that I will be referring to the Medicare benefit for home health services throughout this presentation, since most persons impacted by Alzheimer's disease and other dementias are eligible for their Medicare benefit. However, much of the information I'm sharing today falls in line with coverage provided through Medicare replacement plans and private insurances, though there might be additional copayments and deductibles under these other plans. As always, I recommend getting in touch with your health insurance provider for more information on home health care and all levels of coverage, if Medicare is not the primary insurance for the person living with dementia. So with that, I want to start out by stressing that the name home health care can be a bit confusing because it can lead some people to believe that they will be receiving a substantial amount of attendant care or in-home assistance with activities of daily living. In reality, home health care provides little attendant care, usually only once or twice a week for assistance with bathing and changing bed linens and just a few other personal grooming tasks. I will say more about this later in the presentation, but I wanted to be clear that we are primarily discussing home health care services you see outlined here, and I'll touch on those in just a minute, rather than in-home attendant care. Home health services under Medicare can include all of the service areas you see here, part-time or intermittent skilled nursing care, which refers to care or treatment that can only be performed by a licensed nurse. And that's a really important point to remember. These skilled nursing tasks can include areas like complex wound care, catheter care, intravenous injections, and so forth. This doesn't mean that family members or caregivers can't be trained on how to conduct this care, but it means that a doctor has ordered skilled nursing care for these medical needs at a certain point in time. And only a licensed nurse can carry out that doctor's order. Home health care can also cover physical, occupational, and speech language pathology services, which can help address changes in condition, such as problems with walking, balance, swallowing, feeding oneself, safety of the physical home environment, and many more areas related to everyday life functioning. Home health care can also cover visits from a medical social worker. And this is a position I held for a couple of years during my career. These visits can be very helpful for the family because the social worker can provide community resources for the patient and for the family, such as adult daycare referrals or local support groups. The social worker can also help the family develop a longer-term plan of care and consider options like assisted living, memory care, or skilled nursing facilities. and make appropriate referrals if the family ultimately decides that it's time to make a change in their loved one's level of care. Most home health agencies, and this is a little secret that I'm sharing with you today, only offer a few visits from a social worker when a person is using their home health care benefit, but the family can always advocate and request for additional visits to be covered if the patient or family's social support needs are higher. And I really recommend that families and caregivers ask for those additional visits if they need them. Home health care also covers a part-time or intermittent home health aide to provide personal hands-on care, including assistance with bathing, grooming, again, maybe some other personal care task, styling someone's hair a little bit, changing the bed linens, and so forth. However, it's important for caregivers to know that this assistance is usually only about once or twice a week, maybe 3 times a week at most. In other words, the home health aid component of this service is not provided daily. And I think that is potentially confusing for some families who might be hoping for and thinking that they're going to receive some daily assistance with activities of daily living. While home health care, meaning many of the services listed here, can be provided up to 7 days a week for no more than 8 hours a day, it is rarely provided this often. Usually, patients receive 1 to 3 home health visits per week, give or take, lasting maybe about an hour or 2 each visit. This is why many caregivers still ultimately need attendant care services, additional attendant care services, to meet the complex care needs of their loved one in the home. We'll talk more about attendant care in just a few minutes, but the main point I want to make here is that home health care does not provide caregivers with a significant amount of caregiving relief, though it does provide some. And what the level it does provide can certainly be impactful and helpful for families. And it's important to remember that it's not a very significant level. Other services, such as injectable osteoporosis drugs for women and safety assessments of the physical home environment, are also provided under this service. All right, so with the progressive nature of Alzheimer's disease and other dementias, some caregivers and families might rightly wonder, would home health care actually benefit my loved one? If the changes in condition are progressive, is this service really helpful, or would it be beneficial? Well, research tells us that generally, of course, exercise, and more specifically, many of the services covered under home health care can absolutely result in positive outcomes for people living with dementia and their caregivers. For people living with Alzheimer's disease or dementia, other dementias, research shows that occupational therapy provided at home can help improve a range of important outcomes for the person with dementia, including improvement in their ability to engage in activities of daily living, reduction in behavioral and psychological symptoms, reduction in falls, and improvement in walking and balance. We also know that the physical safety assessments conducted by physical and occupational therapists can help increase overall safety in the home, such as adding grab bars in a shower or removing rugs that could increase the risk of falls. Another potential benefit of home health services is avoiding the need potentially for hospitalization or rehospitalization, because a licensed nurse and other healthcare professionals are addressing and observing the person's care needs on a weekly, sometimes daily basis, increasing the likelihood that they could catch and address an emerging or worsening health need. Another wonderful benefit of home health care is the increased socialization for the person living with dementia. Since home health care often involves an interprofessional team, the patient will likely receive 2 to 3 visits per week or more from someone on the team who is there to provide a specific service, but is also trained to engage with the patient in a meaningful, positive way during those visits. So that can really help provide a socialization element. Research also shows us that caregivers can significantly benefit as well from utilizing home health services, which makes a lot of sense if we think about the benefits that we see for the patients themselves. Those benefits are also going, of course, to bleed over and benefit the caregiver. Studies show that home health care can result in stress reduction for caregivers, and that certainly makes a lot of sense to us. We also know that utilizing these services can result in a temporary reduction in formal caregiving responsibilities, such as bathing and grooming, giving the caregiver a much needed breather from having to provide all of the care day to day. Last but certainly not least, home health care services can provide the caregiver and the family with essential education on safety measures in the home. They can also provide education on medication management, nutritional consultation, and support in many other areas that could improve their overall ability to care for their loved one in the least stressful and most effective way. I also want to note that some caregivers might decide to try home health services at home to see if the person's condition can improve with these services prior to making a care transition decision, which can be a practical way to approach making this sometimes very difficult decision. So in other words, trying out home health services to see can their loved one's condition improve enough to avoid the need for transitioning to assisted living or skilled nursing or some other care arrangement. All right. So what are the limitations? Now, as any good social worker, I'm going to bring you the really positive aspects, and then I also want to be clear about the limitations of home health services. While we know that these services can be very beneficial for patients and caregivers, there are some important limitations to be aware of, especially as caregivers plan for the future care of their loved one. One important factor to be aware of is the fact that personal care needs alone do not qualify a person for home health services. For example, I have worked with families who realize their loved one, they really need a higher level of care. Their care is more than the family can handle, and they inquire about home health care services. But if there hasn't been a significant change in their loved one's condition, such as decreased ability to walk or feed oneself, then the person would not qualify for home health services under the Medicare benefit. And I'll tell you more a bit about that in just a few minutes. But essentially, the person must have a change in condition to justify the doctor's order for the home health care services under their Medicare benefit. These services are also time limited and do not represent a long-term solution to care needs for the patient and for the caregiver. While home health care can be provided, again, up to 7 days a week for no more than 8 hours per day, again, it's often less frequent, as I mentioned before. I have rarely, if ever, seen that level of care provided under the home health care benefit. The general practice involves a much lower frequency in terms of these services. The frequency and duration of the home health visits is actually determined through an assessment conducted by the nurse on the home health care team. And most patients, again, receive 2 to 3 visits per week for around 2 hours approximately each visit. Another important fact to know is that home health care services under the Medicare home health benefit are discontinued when the patient is no longer making what is called functional progress, meaning they have plateaued in the skills they are working on. This plateau might look like walking the same distance or less each week. So for example, a patient might be walking 30 feet, and then the next week they continue to only be able to walk 30 feet, the next week they only walk 20 feet, then the home health services might need to be discontinued if the patient is not making additional progress toward their goals. So again, at that point, the home health services must be continued under the Medicare benefit. Also, a person cannot receive hospice care and home health care services at the same time, though they could be under a palliative plan of care or comfort plan of care and receive home health services simultaneously. So that's a little bit of a distinction there. Some physicians have placed a patient under a comfort or palliative plan of care, but they have not formally signed them up for hospice services. Those patients would still be eligible for home health care services. But if a patient is formally enrolled in a hospice program, then they would not be able to use their Medicare benefit for home health services. And really, this is because home health services are considered restorative and curative in nature. So they cannot be covered simultaneously with hospice care, which is considered end-of-life care or palliative in nature. However, some very short-term physical, occupational, and speech therapy services can be provided under hospice care for a very short period of time if it would increase comfort or decrease the pain for someone under hospice care. So just for everyone's information, there are some limited physical and occupational services available to a patient receiving hospice care. Finally, it's important to remember that many caregivers, as I mentioned before, often need additional attendant care services in their home as they care for their loved one, especially if their loved one has experienced a change in condition that has significantly increased their day-to-day care needs. So as I promised, I want to go over the difference between attendant care and home health services because this is a really important distinction. I keep referring to attendant care services, so I want to make sure I provide a clear distinction between these two types of care and some helpful definitions. Attendant care is medical and non-medically related personal care services provided to meet a person's daily care needs, such as grooming, bathing, meal preparation, etc. While attendant care can include skilled nursing services, this care primarily addresses day-to-day personal care needs rather than a medically focused interdisciplinary team that reports to and is directed by the physician or a physician. Attendant care services are usually selected and hired by the person's family, unless the family is working with a private case manager who is coordinating these services on their behalf. Attendant care, or what is also called private duty caregiving services, are not usually covered by a person's health insurance, unfortunately, unless they have a long-term care policy, Medicaid, or veterans coverage for these services. But most of the time, these services are what we call an out-of-pocket expense. The good news about attendant care services, if a family can afford them, is that they provide a wide range of services that are not covered under the home health benefit, including care for longer periods of time, cleaning, cooking, etc. So, a attendant care service could really come in and really tailor services around the patient's need and some of the areas that a caregiver might need support in, like light housekeeping and some preparation of meals. Unfortunately, many families are unable to pay for attendant care, as costs for these services can range from $10 on up to $25 or more per hour in some circumstances, depending on the person's care needs. I will share a state of Texas resource at the end of the presentation that can help some families with lower incomes who are looking for attendant care services for their loved one. All right, so when is a person eligible for home health care? And how do they know if they qualify for, and how can they access home health care services? Medicare covers home health care services when a person needs part-time or intermittent skilled nursing services, and they experience a change in condition, or they discharge from an inpatient setting, such as the hospital or skilled nursing facility. So those are really the three um, circumstances in which a person could utilize their Medicare home health benefit. A doctor or other home health care provider must see a patient face to face before certifying that they need home health services. So they must have a doctor's visit. If the doctor determines that home health care services are appropriate, they usually refer the family to a home health care agency, which coordinates the services ordered by the doctor. However, families can always use the home health agency of their choice, as long as they work with the patient's insurance, and patients and families can voice their preferences for their specific uh, home health agency. Maybe if they have one that they've worked with before and they would like to work with again, they certainly can do that. All home health care agencies must be certified by the state of Texas and meet specific criteria to be certified to provide this level of care. This last eligibility criteria is very important, which is why I have added even more detail to make sure that it's clear, and to invite any questions you might have at the end. To qualify for home health services, a person must be considered what Medicare terms homebound, meaning they are not going out for social reasons, they're not driving a car or shopping and doing other social activities. They can leave the home for medical treatment, religious events, or adult daycare, but an outing such as to the mall with friends would be a violation of the homebound status, and it could potentially justify the termination of the home health care services. As you see here, difficulty leaving their home due to physical and or cognitive limitations is the primary reason a person would be considered homebound. And I'll share with you during my experience as a home healthcare social worker that this can be a challenging area for some folks who are starting to feel better. They're starting to get some of their functional abilities back, and they want to, for example, go on a social outing with their family member. And while that is totally understandable and a really important thing to be able to do, they would actually need to hold and not engage in that activity, because if the team, the home healthcare team, witnesses ongoing violations of the homebound status, then they would actually be required to end the services. And I've actually shown up to home health visits where folks are, getting ready to go out, maybe to have lunch with a friend, and I've had to let them know that that actually is a violation of the homebound status. So, one violation was not a big deal, but if there was a pattern, then we had to look at whether or not the person still qualified for home health services. So something to be aware of as you are considering these services for yourself, for your loved ones, or for people that you are serving. Another bit of good news for people using their Medicare benefits for home health services is that these services are provided under Medicare at no cost to the patient, which is wonderful. The way in which Medicare covers home health services varies depending on the patient's recent history of inpatient care. If a patient has spent 3 consecutive midnights in a hospital under inpatient care, or had a Medicare covered skilled nursing facility stay, then their home health care is covered at 100% for up to 100 days under Medicare Part A, as long as the patient continues to make progress. So there's a couple of really important points here. I know it sounds strange to emphasize 3 midnights in the hospital. The reason I'm emphasizing that is because some folks go into the emergency room and they are put in a status called observation. And that observation status does not count toward the 3 midnights that would activate this home health care benefit. And so it can be very confusing for patients who maybe had 1 night of observation, 2 midnights of being inpatient, being qualified as inpatient, and then they're not able to access their home health benefit under Medicare Part A. It's also a point of advocacy for families to be able to request, if possible, may my loved one stay another night in this hospital, because they are probably going to need to utilize their home health benefit. And we only have 2 midnights. It can't hurt to ask. I know hospitals prefer to discharge folks as soon as possible. And sometimes a physician can really understand that the patient is going to need that home health benefit. And this extra night would absolutely allow them that coverage. I want to also revisit this point about the fact that the patient has to be able to continue making functional progress for the benefit to continue. And so even though there are a potential of 100 days, there's no guarantee that a patient can use all of those 100 days. If they start to have a plateau in their progress, then they might only be able to use 40 days or 60 days of that benefit. So just something to keep in mind as you're supporting those who might be interested in utilizing these services, or if you are utilizing these services. All right. Another important detail for families to remember is that the patient must, or the family must initiate home health services within 14 days of leaving the hospital or skilled nursing facility for the service to be covered under Medicare Part A. Some families might feel unsure about whether they want home health services at all. They might be unsure at that point of discharge whether they want to begin those services, and they might initially decline them. This can happen because people sometimes don't want people in their home, which is understandable. They might also think their loved one wouldn't participate, or they don't want the services for some other reason. But it's very important for families to know that they only have 2 weeks, that 2-week window, to change their mind and access the doctor's order to utilize their home health benefit under Medicare Part A. Otherwise, they would have to consider utilizing the services under Part B, and often under Part B, the services are a little less frequent and a little bit less intensive. So to get that, maximum amount of service after inpatient hospitalization or a stay in a skilled nursing facility, you really want to act within that 2-week window to access those home health services. All right, for patients who have been at home, shifting over to the right side of this chart, for patients who have been at home and have not been hospitalized in the past 2 weeks, they are eligible to receive home health care services covered at 100%, again, no cost, under Medicare Part B, which is the outpatient benefit under Medicare, but only if they have experienced a significant change in condition and their doctor has ordered those home health services. These services must be recertified by a home health agency at a minimum of every 60 days, and the patient must continue, again, to make functional progress for the services to be provided. Whether home health services are provided under Medicare Part A or B, they require no copay or deductible under Medicare coverage. So again, a fabulous benefit that is basically of no cost to the family. All right, so let's touch on durable medical equipment. The reason I've added this information to the presentation today is that when patients experience a change in condition that often accompanies home health care, they often require new medical equipment to support them with their current level or their new level of physical and cognitive functioning. Medicare covers a wide range of medical equipment, as you see here, though a 20% copay often applies, and the patient must also meet their Medicare Part B deductible unless they have supplemental insurance that might cover some or all of these costs. It's important to remember that Medicare pays for different types of durable medical equipment in different ways, depending on the type of equipment. Families can contact contracted durable medical equipment companies who should be able, and they are able, to run their loved one's insurance and provide them with cost estimates on various types of equipment. I just wanted to touch on the durable medical equipment needs that often come up when folks experience these changes in condition. So, when should someone discuss home health care with their loved one's doctor? Well, there's a lot of reasons, as you see here, why someone might do that. These are just some of, they're certainly not all of, but there's some of the common antecedent events that prompt caregivers and families to consider this level of care for their loved one. Sometimes the changes in a person's functioning are subtle, they're not very noticeable, such as slight changes in behavior or a slow decline in someone's ability to walk. These changes generally should be evaluated by a physician, of course, which might result in a wide range of interventions, tests for potential infections or other medical conditions, and possibly referral to home health care services or other services. Some situations naturally lend themselves to a physician automatically, without the family asking, writing orders for home health care, such as discharge from the hospital after a short or long-term stay, or after medical procedures such as a surgery. I always advise families to inquire with their physician or healthcare provider about home healthcare services and needed medical equipment upon their loved one's discharge from the hospital, especially if these services are not being brought up at the point of discharge or as the discharge date approaches. That's kind of a red flag if you're not hearing from the social worker or the case manager on the patient's unit about these services. Then I really advocate for patients and families to ask about these services. Overall, it can never hurt to inquire with a person's physician about the appropriateness of home health care services, and it can often lead to a larger conversation about the person's overall condition and quality of life. Another bit of good news is that a person can receive home health care services anywhere they live, as long as they are not already receiving hospice care under their Medicare benefit, as I mentioned before. Home health care agencies see patients in their homes, in independent living communities, assisted livings, memory care facilities, and personal care homes as well. People living in skilled nursing facilities can also receive home health care under their Medicare Part B benefit if they are not already receiving short-term rehabilitation services under Medicare Part A. So they can't be utilizing both of those levels of care at the same time, but they can use them sequentially. So let's say a patient is admitted under Medicare Part A to a skilled nursing facility and they use all of that benefit, then they can use Medicare Part B. As long as they still have a need, they can, and they're making progress, they can utilize Medicare Part B for their home health benefit. And this really, this home health benefit under Part B is really for residents who are living in a skilled nursing facility under a long-term care status. So they really are no longer using their Medicare benefit to cover all of their stay. They're paying out of pocket for their long-term care stay, but Medicare will still cover their rehabilitation services, if that makes sense. And I'm glad to answer questions about that at the end. All right. One other fact to know about home health services provided in a skilled nursing facility is that they're often provided by the skilled nursing facility's rehabilitation team of physical, occupational, and speech therapists rather than an outside home health agency. In all other settings, an outside home health agency usually comes to the patient's place of residence to provide those home health services. So like any good social worker, I am ending today's presentation with some resources for in-home care and assistance. Here are some what I hope will be helpful resources for caregivers and families to access more information about in-home care support. 1-800-Medicare, for those of you who have not called it, is really a great resource. I've been told by many people who call, and I've experienced this myself, that the Medicare representatives who answer the phone are very knowledgeable and generally provide really good customer service. The Medicare website also has lots of very useful information about home health care and all levels of care provided under the Medicare benefit. Most of the information I've shared with you today can be found on the Medicare website. I've also included here a link to the community attendant care page on the Texas Health and Human Services website. This program can help families with lower incomes access attendant care in their homes if they meet qualifications. So, if you or someone you know might be struggling to afford attendant care, then it's certainly worth inquiring with this program to see if you might qualify for that attendant care support through the state of Texas. Also, the Austin Area Agency on Aging provides a care coordination service where family members can call and receive case management support when they are making decisions about their loved one's care. And so, if you're wondering, is home health care appropriate? I need help looking for attendant care. I'm not sure what to do in terms of my loved one's plan of care. Then the Austin Area on Aging is a great resource to receive that overall care coordination. If a family has resources to pay for attendant care, these are a couple of websites and services that provide search engines to connect families searching for attendant care with people who are trained to provide those services. Aging Care is a newer site providing this service, and then care.com has been around a little bit longer. I will say, of course, that all families should interview anyone they are interested in hiring to provide attendant care in their home and ask for references and absolutely interview those references to make sure that the person has the appropriate training and qualifications to be providing this care. And finally, Age of Central Texas has a durable medical equipment closet for people who might be looking for a piece of medical equipment that isn't covered by Medicare, or maybe they need an extra piece of medical equipment when Medicare has already covered one for them. This is a great resource for anyone looking for used durable medical equipment here in the Austin community. And this happens a lot where someone got a wheelchair 2 years ago under their Medicare benefit, and either maybe they misplaced the wheelchair or they actually need 2 wheelchairs for various reasons. Maybe they need one at one home and one at another home, and Medicare only will cover one. So this is a great resource for those who really don't want to spend more money or maybe don't have the resources to get an extra piece of medical equipment and would like to utilize that service. All right, so with that, I'm going to stop sharing and open up the floor for questions